one of the things that stood out to us was your vision of an AI native experience.
Yeah.
And maybe just speak to what you've learned in the process and sort of, specifically like how you think about what AI means and looks like in a primary care sort of application.
It's a great question. I think basically like we had to reimagine like a model of care that doesn't exist today. Because going back to your point of, it's about like 10 to 20% of like, the queries or the prompts on ChatGPT are health related. And that's actually not surprising because even before ChatGPT, like 1.5 billion searches a day on Google related to health. Products like WebMD have like 80 million monthly active users. So people have a lot of questions about their health. And the problem that we're solving is within primary care in particular, because primary care is so inaccessible and slow and sometimes even expensive for people just sort of resort to Google or WebMD or now ChatGPT because they just need answers to their questions and they don't want to wait months to go see a doctor for a 15-minute appointment, right? So that doesn't really work. So the current healthcare model is sort of broken in that sense. And so when we set out to build Lotus, we were like, what if we could reimagine the world of healthcare without the constraints that exist today, things like insurance and things like prior authorizations, these things that slow down the process. And even things like the incumbent sort of like EHR systems that are, hundreds of millions of dollars to get started in this space, right? So what we decided to do was sort of build everything from scratch internally, but do it in a way that was patient-centric and also truly enabling doctors. So what we like to say is on the back end, we're building like a cursor, if you will, for doctors, right? On the front end, we're building a entirely new experience of interacting with healthcare for patients, something they haven't experienced yet because it's ultimately a lot of friction today. Nobody enjoys going to the doctor. It's not a positive user experience most people have. So we decided to not only innovate on the actual care delivery aspect of it, but also on the business model aspect of it. And we can talk about that later. But on the care delivery aspect of it, AI really helps us really take vast amounts of data and be able to reason over it and come up with an answer that is just like humanly not possible, right? So when you think about healthcare, that's a really important area to solve in because there's no single source of truth on your health record today. That was sort of the first problem we solved. So what we do is as soon as you become a patient of Lotus, we go and fetch all your data from the existing EHRs, any site of care you've interacted with. So doctors you've seen over the course of your life, especially if they're a part of a health system or, they are a part of a hospital, we can definitely get that data. We're working on expanding our coverage in terms of how much data we can get. We also allow you to connect your wearables data, your insurance claims data. So this allows us to build a really rich sort of longitudinal record on a patient. So we become sort of the system of record. But that was only the first step, right? Now we're the system of action as well, like to your point. We can actually deliver care, right? So we can give you prescriptions, we can give you sometimes near real-time diagnoses, right? Because we're powered by real doctors on the back end, but also the latest evidence, right? When you think about like healthcare knowledge in general or medical knowledge in general, it actually doubles every like almost roughly 2 months. And so it's impossible for a human doctor even to like keep up with that. And that's really, again, where AI shines. So we're building all of these sort of like agentic workflows, but also using AI to not only like have a better sort of care delivery with the patient in terms of conversational AI, but also on the reasoning side of helping clinicians take the right actions at the appropriate times. When we started, we have been working with clinicians from top institutions like UCSF, Stanford, Harvard, and these are doctors that are very interested in sort of building the next model of care at the frontier of sort of healthcare and technology/AI. And we have designed the product day one with them, and they've also helped us set up the guardrails and the safeguards to make sure Lotus's output is high efficacy from a clinical perspective. But beyond that, the actual product, the way it's designed on the back end is a patient has an interaction that is sort of escalated up to a real clinician whenever there's a medical sort of intervention needed. And that could be a diagnosis, it could be a prescription, it could be a referral. So all the basic sort of units of work that you would assume a clinician has to do in a primary care setting, we have sort of created a new sort of version of that where the clinician sees a dashboard where they can take these actions, but they're doing it with the latest sort of like evidence, but also the entire picture of the patient. And then Lotus is suggesting to them, like, these are possibly the actions that you should take, but they're using their own clinical judgment to hit the button and be able to execute an action, for example, right? So when I use that analogy of cursor, that's really how like easy we've made it for the clinician. But ultimately, the clinician actually, that's all they really need. They don't really, that's their entire medical school training is looking at a bunch of data and making a decision, right? And so we've just put all of that on a silver platter for them so they can just make decisions a lot faster and better decisions, actually, because now these decisions and this data is grounded in all the latest evidence that there's no human way possible for them to keep up with, but also in the entire health history of the patient that's condensed in a format for them to actually understand. I think that ultimately, we think by fixing the front end, by fixing the primary care experience, people can get the right sort of answers faster, right? It's the reason why people are sort of saying, hey, I'm sick and tired of the system. I'm just going to go to Google or ChatGPT. But the problem is ChatGPT doesn't have context of your entire health data, and it can't actually give you care, right? So those are the two things that we can actually do, is we can give you care that's grounded in your data and the latest evidence. We can write the script for free. You still have to go to the pharmacy, to your point, to pick up the medication, which then sure, you can use your insurance, or some people are doing self-pay. You have companies like Cost Plus Drugs from Mark Cuban that are also realizing the challenges of pharmacy and PBMs, and they're just saying, hey, like, just buy the drugs yourselves, because insurance, you're going to end up losing money on it anyways, right? So we were just like, can we give you the best possible answer and give you, labs, prescriptions, imaging, all these things or referrals that you need to get started on the right journey to care. And then sure, work with your current sort of system or your provider in terms of like your insurance companies to get that in-person care if you need it. But it turns out 80% of the time, like, people don't need in-person care.